guys, and welcome to an edition of Interstitial Cystitis Chronicles 2. So don't forget don't forget to like, subscribe, all that good stuff. So I want to talk about my urogynecology appointment that I had on today. This is a new doctor that I went to go see. The main reason why I went to go see her is because I wanted her to sign off on a requisition form in order for me to be able to have the Microgen test done. That is the urinalysis send out where they MicrogenDX test for a boatload of different bacterias that your in-house clinical urinalysis machine will not test for. Even when the doctor sends out to the lab that they use for the culture, does not cover what MicrogenDX covers. I did a trial. It was free of charge at that time. They were just looking for people to volunteer to submit their urine, and I have a video on that. And lo and behold, the bacteria was detected. And when I tell you I've never tested positive for a urinary tract infection, nor has anything ever came back positive, even on the cultural send out. So when I did have a bacteria to pick up on the MicrogenDX, I thought, oh my goodness, I was excited. So that was 2 years ago. So moving forward, I have a new clinical provider, urogynecologist, who did sign the form. So in the coming days, I'll be taking care of that to see where we will go from there. Now, me being the IC advocate, I'm big on going prepared with your medical records of your diagnosis, what treatment options, that you have explored with current doctor, previous doctor, just having your history, having in mind what you want to share, even if you have to write it down. I don't like to overload the doctor, but I like to make sure that I can remember what it is that I mainly want to target, and then possibly a subcategory that I may want to talk about. Now, in doing so, normally I do encourage you all, as well as myself, to go with a bladder diary. I'll admit, I didn't go with one this time. I guess I felt like, okay, I'll just let the doctor know. So I kind of did let drop the ball, because she did ask for a record. So let me encourage you, as a reminder, when you are seeing a new provider concerning your bladder, your urinary tract, interstitial cystitis diagnosis, your overactive bladder, and it is a new provider, definitely go with a diary in hand. Your diary will consist of the time of voids, have the time listed, as well as the amount of cc's or how many ounces or mLs that you void. A lot of times they will give you a measurement for your urine to hold, and it has like how many ounces or milliliters, depending on how it's calculated on what the urinal is set up like, but mainly that's universal. And also, if you are experiencing any pain at that time, and where your pain is at, and how did you feel after you did release. Normally, that's what my diary does consist of. Yes, the time and how much volume that I did void. And sometimes I might include if I experienced retention or if I didn't, but I try to keep it simple with those main things to target. And thankfully I knew, because she didn't give me a paper or anything to say, okay, this is your bladder diary log for you to use as a guide. But yes, again, normally I do have that in hand, but I just dropped the ball this time. I just did. And honestly, guys, I felt a little overloaded this weekend. When I last was at work, which was on Friday, Today's Monday, and I knew I had this appointment today. It seemed like so much went on with my weekend. Not my weekend, well, my weekend too. But so much went on at work that it was like, it just totally threw me. So, again, just stay focused, with the coworkers. Be the best that you can be. Speak positive thoughts to yourself, because when the environment and there's a lot going on, that can be stressful. Now, I did notice that my urinary symptoms did increase on that day. Probably would have been a really good diary, but I would have had to have done another one to compare when I'm not under stress. But it was like I was sent to a new location to work at, and none of the coworkers wanted to be of help for what my assignment was. So what I'm used to doing on the job, I just stuck with that and got through my day with positive thoughts. It was a bathroom conveniently located. I just helped myself and went to the bathroom however many times. At that point, I didn't care if you look and ain't look. I didn't care. I was just going to use the bathroom to make it easier on me. And then at the same time, I knew I had this upcoming appointment. Now, another thing I want to mention as well, the doctor, she mentioned that there's a new medication out called Gemtesa, if that is the correct pronunciation. This is a sample, because when it's a new medication and there's no generic forms on market, it can be quite expensive. I looked up the price, say for someone who doesn't have insurance, that you're looking to pay possibly $700. Ooh, is that right? And then how there are discount sites, which I do encourage to use, like GoodRx, very good resource. But if you go on there and you put it in, again, it's not a generic brand out yet. That takes about 10 years, I believe, for a generic form to be developed. But I think I saw, 500. So what I like to do a lot of times, see if the office has samples, and then that way, if it does work, woohoo, I'll be glad to do an update about it. If it does increase my urinary symptoms, to let you all know. But for the most part, hopefully, if it does work, which I'm optimistic about it, I mean, at this point, why not be? But if it does work, then normally what has happened in the past, a prior authorization is done, and then I'll list every possible thing that I have tried, which has been a lot through the years. But the main thing is I wanted to check in and let you guys know that I will be starting a new medication. I saw a new urogynecologist today, as well as the MicrogenDX. I'll be redoing that test again because I did need the doctor to sign off on the requisition form. So, want to check in. So till next time, let me know how you all have been doing as well. Anything new, any new medications that you are trying, any dietary restrictions that are working for you, any supplements. Did you recently have a new urologist visit, and what was done for you? I want to know how are we doing as a community? So check in. How's life going even on the job? Are you finding that stressful? What do you do for coping mechanism for stress, period? Share with me. Want to connect? Okay, till next time, guys. Interstitial Cystitis Chronicles 2, signing off.